Good day, sir. I am NOR-AINE and I'm going to demonstrate the administration of nasal medication. Installation of medical solution into the nostrils from a nasal drops or nasal spray. The purpose is to shrink swollen mucous membrane, to lessen secretions, and facilitates drainage or to treat infections of nasal cavity or sinuses. For the special considerations for the infants, hold the infant in the cradle position and stabilize the head and tilting it back. Then give nose drops 20 to 30 minutes before feeding. Infants are nose breathers and nasal congestions inhibit sucking. And for the equipment needed, the tissues, correct medication bottle with a dropper, clean and disposable gloves optional, and the small pillow optional. Procedure. For the preparation, perform drug study to avoid clinical errors and to know the purpose of the medication. Next is to check the MAR or the medication administration record for the drug name, dosage, frequency, route of administration, and expiration date. Next is to check each medication card against the physician's order. Then next is to secure all the necessary equipment and obtain appropriate medication. Prepare the medication in the medication section for one patient at a time.
So good day, sir. Ako di ay si NOR-AINE, a student nurse from MSU IIT. So karon sir kay hatagan ti kag tambal para sa imong ilong, sir. So unsay imong pangalan, sir?
Jalani di Barang.
Jalani Di Baraton. So after that, bring the medication to the client's bedside, then perform hand hygiene and don the gloves. So let's assume that we already do the hand washing and donning the gloves. So next is to provide the patient with a paper tissue to blow his or her nose. So sir, na ako'y paper tissue para gamiton nimo sikmahon nimong sipon sa ilong, sir.
Karena
Yes, sir. So, ilapay na to ang paper tissue. So, next is to have the patient sit up with head tilt back, or if the patient is lying down, the head is tilting back over the pillow. So, okay na siya kay nanay pillow sa iyang ulo. Then, next is to draw the solution into the dropper. So, let's assume that the solution is already drawn in the dropper. So next is to hold the tip of the dropper just above the nostril of the patient. Then direct the solution laterally in the midline of the superior concha of the ethmoid bone. Hangad, sir. So after dropping a solution to the nose, have the patient remain in his position for 5 minutes.
Excess solution should not be returned to a stock bottle and dispose of all the supplies appropriately. Do hand washing to avoid contamination. Next is to document each drug given on the medication card. Record the dose, the time, and affix your signature. If a drug was refused or omitted, record this fact in the appropriate record and document the reason. Then record any fluid intake of the client. Then return to the client when the drug is expected to take effect, usually 30 minutes. Then report significant deviation from normal to the physician.